Hello, my name is Celia Smith. I'm currently an LPN enrolled in Indiana State University's LPN to BSN program. We're going to do a presentation today on tobacco use. If you could please take a moment to complete the pretest, you can find this link in the information bio section of this YouTube video. I'll give you a moment here to go ahead and complete this simple 10-question pretest. The objectives of this video, you'll be able to define what tobacco use is, identify a few different forms of tobacco use, identify some risks associated with tobacco use, identify forms of smoking cessation, identify a few smoking cessation tips. What is tobacco use? Tobacco use is the habit formed when consuming a tobacco plant leaf or its products in any manner. A few statistics on tobacco. According to the CDC, smoking is the leading cause of preventable disease, disability, and death in the United States. Approximately 480,000 deaths occur due to cigarette smoking, and approximately 41,000 deaths occur each year due to secondhand smoke in the United States alone. In 2019, 36.5% of all youth in the United States that were enrolled in high school currently reported using some sort of tobacco product. 6% of that was smoking cigarettes. In 2019, roughly 34 million individuals smoked cigarettes, 15.5% being men and 12.7% being women. Each year, on average, the nation spends more than $3 billion on smoking-related illnesses, according to the CDC. Different forms of tobacco use. They typically fall into two different categories: smoking tobacco or smokeless tobacco. Smoking tobacco is cigarettes, which is most common. Things like cigars, pipes, vapes, or the e-cigarettes. Smokeless tobacco is the snuff, chewed on tobacco that you stick in your lip, and you can suck on tobacco lozenges, even sucking on the tobacco chew. Tobacco companies typically alter their product to be more addictive. They spend billions of dollars on marketing alone each year. They add addictive substances to their products that keep the consumers coming back. This is a list of just a few things that some tobacco companies add into their products. Tobacco use has some short-term effects as well as long-term effects. A few of those short-term effects can be bad breath, simply from the smell of the cigarette smoke in your mouth or the smell of the snuff or chew in your mouth. You can have shortness of breath from the irritation in your lungs, same with coughing from the irritation. You can have an alteration in your taste or smell. It alters those taste buds. You can have some fatigue. Sometimes that nicotine rush makes you feel a little tired after you have that initial increase of energy. Some long-term effects of tobacco use. Smoking can cause several different types of long-term health issues. Cardiac issues. It can increase your blood pressure. It can increase your heart rate. It can cause irregular heart rhythms, and it can also tighten major arteries, and it also increases the risk for stroke. Long-term effects of tobacco use also happen in the respiratory system and the lungs. Damages to the small sacs in your lungs called alveoli happen, and you can't exchange air very well. Smoking can also cause COPD, emphysema, and acute bronchitis. Smoking can also cause cancer in pretty much every part of your body. It's also known to cause circulation issues, atherosclerosis and arterial sclerosis, causing loss of elasticity in vessel walls, causing a decrease in circulation. It can cause fertility issues in men and women, damaging the genetic material in the egg and the sperm. It often causes miscarriages and an increase in birth defects among women who smoke. Some effects of secondhand smoke. Your loved ones can be exposed to secondhand smoke being around you even if you're not actively smoking. Those toxins are stuck on your clothes and body. This effects can be heart disease, respiratory and lung issues or disease, even lung cancer. The toxins from secondhand smoke are actually one of the most dangerous contaminants in the environment today. This is just a really cool picture of healthy lungs on the left, nice and pink, and then smoked lungs on the right. All of that lungs or the lung tissue is damaged. Okay, smoking cessation. Smoking cessation can reduce the risk of premature death. It also helps improve your overall health and should improve your current quality of life. The CDC also states there is evidence that smoking cessation can reduce your risk of these 12 types of cancers: mouth and throat, voice box, AML, kidney and renal and pelvis cancer, uterine or cervix cancer, urinary bladder, esophageal cancer, lung, bronchial and tracheal cancer, liver, stomach and pancreas, and colon and rectum. Smoking cessation also helps improve those around you, the risks that they're put up against with the adverse effects from the secondhand smoke. You can contact your doctor or your local pharmacist about taking the first step in quitting. There are typically local individual or group counseling sessions someone can participate in to assist in the cessation of smoking. There's also medications, oral medications, lozenges, and gum. Some people have tried hypnosis and acupuncture. There's also a free telephone quit line. It's 1-800-QUIT-NOW. They provide support and counseling. Some tips that was provided by the Mayo Clinic for smoking cessation. Try a nicotine replacement therapy. Avoid triggers to the best of your ability. Sometimes that's not always realistic, but making that effort to try. Convince yourself that if you really need a nicotine fix, wait 10 minutes, and typically you'll get distracted with something else and forget all about it. Distract your mouth with something to chew on. Don't tell yourself you'll have just one more. It may cause you to start using tobacco and relapse all over again. Find a physical fitness activity that you enjoy doing that causes distraction and something new to look forward to. Find a relaxation technique that you love and practice it when you're feeling the need to give in. And always ask for help if you need it. All right, you guys, that summarizes the presentation on tobacco use today. Please take a moment to complete the post-test also that you can find in the information in the bio section of this video. I'll give you a couple moments to do that. Thank you so much for watching this presentation. I hope you enjoyed it. Here's also a list of references that I used to gather my information. If you feel the need to do some more research into this, these are some stellar resources. Have a good day.